I want to take a few minutes to give a little background information on the SIU Vascular Surgery Integrated Residency Program. I also want to thank you for looking at this information and for considering SIU as you contemplate the next stage in your career. SIU has a long history of involvement in surgical education. The school is relatively young, celebrating its 50th anniversary this year. Our first vascular fellows were here in the 1970s, and we achieved accreditation in 1985 when the accreditation process began by the forerunner of the current ACGME. 30 fellows have completed the program before we changed to a 0+5 integrated residency model in 2011, and 5 integrated residents have completed the program so far. Historically, the division has had 2 prior chiefs. Dr. Sumner was the first, and he was involved with the early development of non-invasive vascular testing, which has always been a strong experience here at SIU. Dr. Sumner was also involved with venous disease and literally wrote the book on vascular hemodynamics. Dr. Hodgson was a successor, who was, of course, a strong advocate for endovascular training nationally for vascular surgeons and is a recent past president of the SVS. Dr. Hodgson retired in 2019. We now have a third chief, Dr. Will Robinson, who recently joined the school, and we eagerly await his imminent arrival. Dr. Robinson was a student of the SIU School of Medicine who completed his surgical education at other institutions, and he will bring a fresh perspective on when arriving back to Springfield. I'm Dr. Hood, the current program director for the residency, and have been the PD for a little over 10 years. Over the last 2 years, the residency program has joined forces with a local group of 5 vascular surgeons and a multi-specialty group here, and they provide additional educational opportunities for our trainees. 3 of the 5 have SIU ties as former trainees or students, and all have a dedicated interest in the strength of the program. They bring a unique perspective to the program in terms of modeling experience outside of a strictly academic realm, as well as case volumes, and are all very much interested in teaching. There are 2 hospital partners that we work with here in Springfield, Memorial Medical Center and HSHS St. John's Hospital. Both are tertiary care facilities for the 2.5 million residents of Southern Illinois, and both hospitals have about 500 beds with separate dedicated cardiovascular operating areas and hybrid operating rooms. The hospitals are located only 8 blocks from each other, less than a mile apart, so traveling between the hospitals is easy to see consults, go to conference, etc., and we all work out of both hospitals on an almost daily basis. Our clinical teaching services are structured as an SIU team and a Springfield Clinic team that may include patients at both hospitals, with extensive daily cross coverage between the teams for cases and night call. Next is an example of our block diagram listing the clinical rotations. The final 2 years of the program are dedicated to vascular surgery. In the 3rd year, there are 6 months of vascular, as well as rotations on cardiothoracic surgery and cardiology, trauma, and critical care. The first 2 years of the program each include 4 months of vascular surgery, with other unique experiences, including a dedicated month in the vascular lab for opportunities with hands-on scanning, an ortho foot and ankle rotation for a non-vascular perspective on the diabetic foot, a body imaging rotation for experience with cross-sectional techniques such as CTA and MRA, as well as some exposure to interventional radiology. There's a head and neck rotation to become more comfortable with that anatomy and those disease processes. There is a plastic surgery rotation that adds wound management and surgical wound reconstruction, and an anesthesia rotation to increase awareness of what happens above the drape and provides additional invasive line and intubation experience. While all vascular surgery programs provide a similar basic experience, there are subtle differences in the clinical experience in each program, and I think that our experience at SIU offers a broad and complete exposure to the breadth of a vascular practice. And I encourage you to compare our experience and structure with other programs as you make decisions regarding program selection. I hope that you found this introduction to be informative and helpful, and if any additional information is required, you may contact our program director, Rhonda Lloyd, or myself using telephone or email. Thank you.